Hello, good morning. It is April 8th, 2020. I was asked today to go over two of the orders that have come out, one on April 3rd related to the temperature screening at the stations, which starts this morning at 6:30 a.m., and also the one that came out yesterday, April 7th, related to the wearing of masks at the station. So let's start with the first one. The first one, it's important for the department and for members to know their health status. So we're ensuring that you're healthy when you come to work, that there's no risk of you having unknowing infection and spreading it to your colleagues or to the patients you encounter. And so that's the primary goal with the screening order. What the process will be is there will be two temperature screens in a day, 6:30 a.m. and 6:30 p.m. The department has sent out both a non-touch infrared thermometer and a standard oral thermometer. What we found on testing is that the non-touch infrared thermometer, which you'll point at your forehead and get a temperature, can sometimes run low or at least lower than the oral temperature, which is closer to the core temperature. And so you'll see that the bulletin says that you will have your temperature taken, and if it's 99 degrees or higher, we need to confirm the oral temperature to see if it reaches the maximum point of 100.0. So you'll take your temperature with the infrared. If it's 98.9 or less, then you're done for this temperature check. If it's 99 or higher, then go ahead with the oral thermometer and take it orally and see what the temperature is. Now, you can't eat or drink anything right before doing that. Your mouth needs to be at normal body temperature and take that temperature. If it's 100 degrees Fahrenheit or higher, that is of a concern and needs to be reported. The other thing that we're checking for are the signs and symptoms of coronavirus, which, as we've all come to find out, are pretty varied. So it's everything from cough and cold symptoms to sore throat to loss of smell or loss of taste. The person who's doing this checkup should inquire about those symptoms as well. And if we have an abnormal finding, then infection control needs to be contacted. So what the policy does talk about is, one, that the outgoing station captain is responsible for either doing or delegating the temperature checks on the incoming shift, and that they would be doing that in a non-temperature controlled area of the station, so somewhere out in the bay. We don't want someone who is potentially infectious to come into the kitchen, to get some coffee, to sit at the communal table or anything like that. We want that to be caught before they get inside and potentially leave, have some cough or leave some infectious particles lying around the station that other people will inadvertently pick up and perhaps infect themselves. So outside in the bay, 6:30 a.m., 6:30 p.m. The other thing is you cannot take medicine which reduces your temperature. So I'm talking ibuprofen, Tylenol, naproxen, Aleve, Advil. You can't take any of those medicines within 6 hours of the temperature check. So to stay compliant with this order, you can't take any medicine past 12:30 a.m. And then you can't take it all the way through till at least 6:30, after 6:30 p.m. after your second check. Okay. If you're masking a fever inadvertently by taking those medicines for body aches or pains, then that ruins the whole purpose of the station monitoring. When you get signs or symptoms, even if it's a singular sign or symptom, or you get the temperature of 100 or greater, you need to call in to infection control and have that have the presentation described to them. We can put you out of service, have you go home. The bulletin talks about going home on workers' compensation, and we can arrange testing for you either that day or the next day, depending on what time of the day you're calling. And so this is a practice that the other fire departments in Texas, for the most part, are doing, and it's a good public health measure for us to do in the department. The second order I wanted to talk about is the one that came out yesterday about surgical masks in response to COVID. The idea here is that more and more evidence, even though we just talked about checking you for signs and symptoms of having the disease, more and more evidence is coming about that you can be infectious without having signs or symptoms of the disease, right, or fever. And so the idea is that we want to minimize as much as possible transmission of the virus at the stations. Because since we've been doing a really decent job with PPE in the field, more of our people have been put on restricted status because of station contacts rather than failures of PPE in actual patient care activities. And so we believe that, though not perfect by any stretch of the imagination, wearing masks can cut down the infection. So the biggest point to understand is that you wearing the mask does not protect you from getting the infection. Okay? The pores in paper masks and surgical masks are larger than the actual virus size, and air can come in and out the sides and top since it's not a fitted mask. So they don't protect you. But where the protection is believed to occur is that if I am the one that has the infection and I don't know I have it, and I'm at risk of spreading it by breathing or coughing, that the mask on me will capture those droplets which contain the virus onto the mask. Thus, I'm not coughing on the table, the countertop, or whatever for someone else to pick up and get. And so everyone wearing the masks ensures that if anyone has the disease, we are lowering the risk of them spreading it to someone else. And so that's what the order talks about. The order says that everyone on duty, and that goes for firefighters in the station as well as administrative and other areas in the department, should wear either the surgical mask, which is the thin surgical one, the same one we have you put on the patients, or you can wear a cloth mask. And the department is anticipating having cloth masks for every member either by the end of the week or early next week. We know that those are being made. Wearing of the surgical mask at the station does not replace any of the PPE requirements that are still required in patient interactions. So the biggest difference being the N95 when you make an EMS run is still required. The order talks about wearing the mask all the time. Good idea to also, if you're going to the grocery store, to wear the masks at the grocery store. The times where you cannot wear the mask, whether that's when you're eating or drinking, is important for you to maintain the physical distancing of 6 feet. So this will require you to make some alterations in standard behavior, perhaps when you're eating breakfast, lunch, or dinner. And so that is talked about in this memo. One of the advantages to wearing the masks as described in this is that if someone does have a member at their station who tests positive, what we currently are having to do is quarantine the entire station, at least the members that interacted with that member and got within 6 feet for any reasonable length of time. If the person who is positive unknowingly is wearing the mask at the station, and you're wearing your mask at the station, then the CDC would consider that a lower risk of what they call household spread, and that we can put those members who otherwise would be quarantined, we can now put them on self-monitoring, consider it low risk. So our hope is that we won't get large swaths of stations being sort of wiped out from one exposure. We'll still have to go through and have a discussion with infection control about whether you were wearing your mask when you were supposed to, whether you were distancing when you were not wearing your mask while eating or whatever. But that will allow a greater number of people to remain on self-monitoring. So I hope that explains in a little bit more detail what the impetus was for these two orders. I know it's a little bit of a hassle to do the station monitoring twice a day and to wear the masks while you're at the station and you feel like you should be relaxed. But it's all to try to maintain the health of the department so we can do our fundamental job, which is respond to the emergencies in the city. So thank you for your attention. Thank you for your adherence to these orders. And if you have any further questions, you can contact either the medical direction or infection control. Thank you.